Hi guys, I'm Leslie and I'm on the Nurse Wellbeing Project, and I wanted to tell you a little bit about something new that rolled out, and it's macros. Macros allow you to document commonly populated questions with one click. Personal macros can be created in your Navigator or your flowsheet. Look for the Macro Manager button in your Navigator. It'll be in that section of your toolbar at the top of the page. I do have step-by-step instructions that I will have available for you guys to click on. One of the things that we recommend you do to make a macro is if you have a patient that comes in and it's a general, everyday run-of-the-mill patient. For example, on my unit, I would say a gallbladder or an appendix. Young, healthy, nothing that's going to fall really outside of those within normal limits, except for the abdominal incisions and their bowel sounds. So I went in and I created myself an abdominal surgery macro. So everything is within normal limits. His heart rate, his neurological status, everything is normal. So I documented all that and I created a macro. So now I get a new patient, that patient comes in and it's an appendix and he's 26 years old. What I do is I get that patient in, I do my admission with my Navigator that I set up as a macro with one click, go in and add anything extra that is out of the normal for this patient, and then I do the same thing in my flow sheet. So I will document their assessment with one click. I will scroll down to the incision and I will document the incision, because you won't document that in your macro because it changes for every patient. And then also gastrointestinal, his bowel sounds, when his last bowel movement was, those things you will add in right there. Anything else that may fall out of normal. So for example, if this patient comes in and his heart rate's irregular, I'll just scroll up to that macro that I made and it says cardiovascular, heart regularity. I'm going to change that to irregular. Easy. Save or file your macro or file your documentation and you're done. Your patient was just documented on with just a few clicks instead of filling out each and every item on that flow sheet. That's pretty much it. You create for whatever you use on your unit that would work specifically for you. A lot of people are utilizing them for IV maintenance as well. I do have some hesitation with that just because we do need you to lay eyes on those IV sites every 4 hours if they're infusing. So make sure that you're looking at the IV sites and not just using your macro and documenting them. Other than that, it's an easy way to quickly document on your patient and have more face-to-face time instead of face-to-face with your